here, which means to extend the skin here, we have to put the arm into what position? Into this position, okay? Okay, has had a fracture, okay, 8 months ago. Okay, so the patient has had a fracture 8 months ago and has a drop wrist. So extend, you can't open, lift up. So we have rigidity, okay, and so we have compression over the radial nerve and ulnar nerve, and so inability to extend the arm, okay? Okay. So in the last few days we are talking about the tape. We are applying a tape which is going to dilate. The waveform creates dilation. The waveform creates extension, okay? Elongation. So in this sort of situation, what is the first contraindication for a tape which dilates? What is going to be the contraindication? Where you do not want to increase blood circulation. What is the first one? As a contraindication, what do you think? If you have internal hemorrhage, if you have internal bleeding, and you apply a tape which is going to dilate, what's going to happen? The blood is going to increase its velocity in that area, and so internal bleeding is going to get worse. Second contraindication, okay, which is what we're going to be asking here. So what is the contraindication here? No. What do you think? Infection. If he has an infection, we apply a tape or we don't apply a tape? We don't apply a tape. If the patient has an infection and to apply a tape, the blood circulation is going to increase and the infection is the healing process, and then we're going to apply the tape over the arm. So the tape is 20 centimeters, which means from the bandage up until over the shoulder, between one tape and another. It starts to wrinkle. It's not an acute phase. This is in a post-acute phase, okay? But the body is having difficulty to heal. And so we have lots of immobility. Immobility means limited blood circulation. And so if you have medicated, you are going to apply the tape around the wound to help it heal. Okay? So, now we are going to continue, okay, over the shoulder. So 1, 2, and 3, okay, and to apply the tape, okay. So you need to stretch the skin and to apply the tape, okay. Also here. So stretch and to apply. Okay. See, I think it's okay. So like this. Okay. Now we have to apply the tape here, which means to extend the skin here, we have to put the arm into what position? Into this position. Okay? So if you can lift up your arm. Okay, stop. And a little bit back. Stop. So he has lots of pain and lots of rigidity. So you see here, the pectoral muscle, very tight. So apply like that. Yeah, just keep it like that. You can't be interested in that part. Okay. Because maybe in another patient, after 8 months, the fracture is already healed. Okay. Maybe there's no problem after 8 months. But sometimes in some patients, like this patient, it's very slow to heal. So we need to help the healing process. Just drop the arm a little bit. Okay, so you see here the wrinkling process in the anterior part of the shoulder and all sides. So stretch the skin in one direction. Okay? Okay. So, okay, flexed. Okay, maximum range. Very tight, okay? And so, just rub on top several times, 10 times, to make sure that the tape sticks well. Okay, just like that. How do you feel with the pain? Same? See the rigidity. Okay. So, one extends and the other one applies, no tension. Okay. Okay, and so you see also on the anterior part of the wrist. Okay.